Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it. We all take our kidneys for granted, but they have an essential role in maintaining homeostasis. The kidneys are like the gatekeepers of the bloodstream. They filter waste products out of the blood while retaining substances that the body needs. As you recall, this elegant process, better known as selective filtration, starts at the glomerulus. If the glomerulus becomes damaged, either due to a primary glomerular disease or a systemic disease that affects the glomerulus, its permeability can be altered, causing inappropriate excretion of macromolecules in the urine. Nephrotic syndrome is a clinical syndrome that's caused by damage to the glomerular basement membrane, leading to altered permeability of the glomerulus. And in this scene, we've recreated the glomerular basement membrane at Hadrian's Wall. Did William Wallace actually fight the English at Hadrian's Wall? Probably not. Is the First War for Scottish Independence the perfect setting to learn about nephropathy? You bet your proteinaceous pea it is. The nephrotic syndrome is defined clinically by a triad of heavy proteinuria, hypoalbuminemia, and peripheral edema. It's a classic condition that every medical student must be able to recognize clinically, and since exam writers love it, it's also a favorite nephrology topic on board exams. So in this video, we'll cover the clinical presentation, diagnosis, and management of nephrotic syndrome. Feel free to use the nearest restroom now, because we'll be talking about urination pretty much the entire sketch. I can wait. Altered permeability of the glomerular filtration barrier leads to increased filtration of proteins into the urine, resulting in heavy proteinuria. This protein is comprised mainly of albumin, but also includes anticoagulant factors, especially antithrombin, transferrin, immunoglobulins, hormones. It's like a protein party in there. Over time, the massive amount of albumin lost in the urine depletes albumin levels in the blood beyond the synthetic ability of the liver, which causes hypoalbuminemia, as depicted by that depleted picture album. Enter King Edward I, also called King Edward the Edematous. Don't quote me on that. Needless to say, hypoalbuminemia lowers plasma oncotic pressure, causing fluid to shift into the interstitial space. Due to the decreased intravascular volume, renal sodium retention is increased. As a result, edema and effusions are cardinal features of nephrotic syndrome. Nephrotic syndrome can be caused by either primary glomerular disorders or systemic disorders. Focal segmental glomerulosclerosis, for example, has both a primary or idiopathic form, as well as secondary forms associated with drugs, toxins, viral infections, and even obesity. Glomerulosclerosis describes the hyalinization and obliteration of glomerular capillaries, and this occurs focally, i.e. only in some glomeruli, and segmentally, i.e. only parts of each glomeruli are affected. Minimal change disease is the most common cause of nephrotic syndrome in children. Hence this protester kid here telling King Edward to suck it. Minimal change! Minimal change! Minimal... Okay, I'm not gonna lie, I think we need a more effective slogan for the Scottish independence movement. Anywho, keep in mind that minimal change disease can be seen in adults too. It most commonly occurs as a primary idiopathic disease, but can also occur secondary to drugs, neoplasms, infections, and even allergies. Another common cause of nephrotic syndrome in adults is membranous nephropathy, illustrated here by the long membranous cape, which depicts the characteristic basement membrane thickening. It too mostly occurs as a primary idiopathic disorder, but can also occur secondary to drugs, hepatitis B infection, and malignancy. Nephrotic syndrome can also be caused by systemic diseases that affect the glomerulus,